Good afternoon, everyone. Today I'm going to discuss about novel use of Circle software for management of epithelial ingrowth after smile surgery. I have no financial interest. Also, I would like to put this on record that we have already published this paper in a prestigious journal, so this will not account for any competition. So in this case, a 35-year female who was referred to us with the chief complaints of gradual painless progressive diminution of vision for 3 months in her right eye. The patient had undergone uneventful smile surgery 3 months back elsewhere for refractive error of minus 3.5 diopter. The diminution of vision began 1 week after smile surgery in her right eye. On presentation, her corrected distance vision acuity in her right eye was 6 by 36 with mixed astigmatism. Her left eye uncorrected vision acuity was 6 by 6. So on slit lamp examination, an area of epithelial ingrowth which was significant and it was in a visual axis. The confluent epithelial nest were limited to the central cornea and there were no peripheral extension toward the smile incision. The incision edge appeared to be intact and devoid of epithelial fistula, which was confirmed by fluorescent staining. So in this case, as you can, which was again confirmed by on AIOS2025, showing hyperreflectivity at the interface and significant topographic changes. So the mechanism of epithelial ingrowth could be postoperative migration of epithelial cells from incision toward the visual axis, loose epithelium at the smile incision, progression through epithelial fistula, and intraoperative implantation of epithelial cells during lenticular dissection, resulting in isolated epithelial nest away from the incision. So most of the reported cases of epithelial ingrowth after smile have been non-progressive and self-limiting. In literature, only 2 cases of progressive epithelial ingrowth after smile surgery have been reported, and in both of these cases, they have tried manual epithelial debridement to original smile incision, and there were recurrences noted. So, how to plan in this case? The epithelial ingrowth was localized and restricted to the visual axis with no peripheral advancement towards the incision. Using the same incision for debridement would have increased the possibility of reimplantation because the epithelial cells were implanted to the original smile incision. As there was no fistula, a smaller smile incision cannot provide complete access for thorough mechanical debridement of epithelial nest, underlying stroma, and flap undersurface as well. So Circle software is a specialized software traditionally used as an enhancement tool. It allows conversion of smile cap into the flap, which gives access to the interface. So this is a donut-shaped femtosecond laser, creates a lamellar ring, the ring-shaped extension of the existing surface cut. It creates a junction cut to the new incision to the older one. So, and it does not add any additional laser to the interface. So in this video, as you can see, a donut-shaped femtosecond laser is being applied, converting smile cap into a flap using Circle software. We are carefully dissecting and lifting the flap to gain a complete access at the interface ingrowth. And then the ingrowth is gently debrided from both the sides, underlying stroma and the flap undersurface as well. We have used mitomycin C and absolute alcohol to make sure complete killing of the cell nests. Replacing the flap, again we are viewing this on a slit lamp view of Visumax to make sure the complete debridement of the epithelial cell nest. So as you can see, there is a significant improvement in topography as well as in a corrected distance visual acuity to 6 by 9 with -1 cylinder only. So with this same novel approach, 2 more cases have been treated at LV Prasad Eye Institute. We have clubbed this all 3 cases and published in a reputed Journal of Refractive Surgery. So here we report a novel therapeutic indication of Circle software to manage epithelial ingrowth as it facilitates cap to flap conversion and consequently provides complete access to the original interface. After creating a flap, we could achieve necessary access to the isolated interface epithelial ingrowth and ensure its complete removal without recurrence, which may not have been possible through the smaller primary smile incision. Hence, employing the Circle software to successfully treat the vision-threatening epithelial ingrowth after smile provides a novel and unique approach leading to the optimal results. Thank you.
So this is not for the competition, you said. So do you educate this technique for all the ingrowths? Because doctors have attempted through the same smile incision also. So when do you say that we should use this circle and then lift, make a flap, and or should we try through the same smile, the ingrowth?
Ma'am, majority of the epithelial ingrowth are non-significant and non-progressive, but if it is in a visual axis and it is affecting the patient's
Definitely. You have also shown the other two cases which was done in LV Prasad, which was quite. So
yes.
you advocate that we should make it a flap and then remove
Yes,
instead
ma'am.
of going through
Yes, ma'am. To gain a complete access, here we can debride the
on the back side.
and the backside of the flap
Yes.
as well with this method.
Yes, thank you.